From her headquarters in Mount Pleasant, Tylar Brannon and her team are revolutionizing healthcare, offering innovative solutions that help patients achieve more balanced lives. Women's History Month is a special time to highlight those who serve as inspirations to women everywhere. As the CEO of Optimal Bio, Tylar Brannon is a perfect example of just that, and we are happy to have her here with us today. Tylar, welcome to the show.
Thank you for having me. Excited to be here.
So you are a female CEO in a male-dominated field. How did you get here?
Right, like who knew anyone's going to be a CEO, right? Yeah. Maybe someone, but just had a journey. So the medical director is actually my dad. So he was an OB for over 30 years, and he started doing hormones at his OB practice. And then long story short, we started with Optimal Bio about 2018, 2019. And at that point, I was just coming in to help out. And then someone recommended me to stay and create my own company. And so that's when we rebranded to Optimal Bio in 2019. And then since then, we've opened almost 8 new locations.
Oh, how incredible is that? And now you mentioned hormone therapy.
Yes.
So is that what Optimal Bio does?
Exactly. So Optimal Bio specializes in hormones, specifically in bioidentical hormone replacement therapy, which is a mouthful, but what it means is that it's all natural. So it's the exact same molecule that your body produces, so it knows how to metabolize it. So you're not going to have negative side effects like a synthetic hormone, and then it's dosed to each person's blood work, so very personalized to them.
Okay, so bioidentical is the key word. That's what separates Optimal Bio from other hormone therapies.
Exactly.
So what would someone who's looking to come get treatment, what are they experiencing?
Yeah, so the top reasons why we see people every day, no matter if they're 20, 40, male, female, brain fog, fatigue, tired of being tired, that's top reasons why we see people. Anxiety, depression, trouble sleeping, and lack of concentration.
Oh, wow.
Yeah.
Okay, so are there any illnesses or diseases other than like mental disorders that hormone replacement therapy, bioidentical specifically, could help with? Of
course. So what people don't realize is testosterone, for instance, has 500 functions in our body. Every cell in our body has a testosterone receptor. Specifically for women, we need more testosterone than estrogen. A lot of people think of testosterone as a male hormone. It's a human hormone. So to answer your questions, yes, it can help a lot of diseases. For instance, testosterone helps clear out inflammation, which is the root cause of multiple diseases. So we see people, all walks of life. Someone who just wants to feel better day to day, people that are struggling with different things. We do a lot of work with PTSD, TBI. So we always say we want to make you just feel better, feel like you, and that spectrum's for different people. And then it keeps you healthy. So it acts preventative. So when your hormones are optimal, it helps protect your brain from dementia, your heart from heart attacks, bones from osteoporosis, helps clean out inflammation. So really a twofold effect of day to day and then keeping you healthy.
So it's almost like something that some people should just consider doing even if they're completely healthy.
Exactly. And then too, as a society, we're getting sicker. And specifically for women, we're very strong. So we're like, oh, it's fine, I feel tired. Oh, it's fine, I don't sleep that well. But that's not how we should feel. And yes, as we age, our hormones decrease, but because of environmental factors, we're all so much lower. So these things that may be common amongst us, it's not how our bodies are supposed to. And then yes, that preventative aspect is so, so important, because healthcare in America is usually that Band-Aid fix, but we want to prevent that, right? Keep you feeling good, keep you healthy.
So what would the treatment process look like from start to finish?
So first, before you even come into an office, you have a new patient call, really deep diving, because education is so important. People don't realize the importance of hormones, bioidentical, so answer all their questions, walk them through the process, come in for a consultation with one of our providers, go in any of their questions, health history, symptoms, why hormones, how do they work, and then after that you get blood work. Because we dose your dose off of your blood work, you come back in, review your labs, and then start treatment. Women get treatment about every 3 to 4 months, men every 4 to 6 months.
Okay, so it is something that is consistent. It's not like a one and done thing.
Exactly. Unfortunately, yeah, there's no way that we can make your body start producing their own hormones, but it is only a few times a year.
Okay. And now before we let you go,
Yes.
do you have any advice for female entrepreneurs?
I would say do it, but make sure you're all in. If that's what you want to do, it's going to take a lot of hard work, but it's incredible, and it's a journey that you should do.
And now where can our viewers go to learn more about Optimal Bio?
Yes, so our website, optimalbio.com, so much information. We have a podcast, YouTube, and our Instagram, Optimal Bio. Also, like I said, education's huge, and so that is what our content really is.
Wonderful, Tyler. Well, thank you so much for sharing that
Thank
with us
you.
today. We're back after this.